Good evening, YouTube. DutyRon checking in with another video. And tonight, ladies and gentlemen, we're going to be talking about the coronavirus pandemic. We, as the United States, have surpassed the China totals. The United States has now the most coronavirus cases in the world, confirmed at over 85,505. My name is DutyRon, retired NYPD detective. I have 20 plus years in law enforcement. My brothers and sisters who are out there still working on the front lines, I say my prayers and tell them to stay safe out there. Thank you to everyone who has been waiting in the lobby. I appreciate my moderators, Michael B., Winky Whispers, Trevor JP. Hello, Chrissy Pilkington. Thank you so much for being here. Marcy, Angela ATF, Bergstrong. The list goes on and on. If I don't get to you guys, I apologize. What you're looking at right now is the coronavirus COVID-19 global cases by the Center of Systems Science and Engineering at Johns Hopkins University Hospital. Johns Hopkins University, 531,708. That's a frightening number, ladies and gentlemen. But there is no need to panic. There is definitely no need to panic. We do have a situation where this is spreading like wildfire. Just remember, here in New York, we have population density. Population density is described as living in close quarters where spread can happen rapidly. These are the numbers for worldwide. 531,000, over 500,000 confirmed cases worldwide, 24,000, almost 24,053 deaths, 122,203 recoveries. I'm going to switch to the United States. Here's your United States figures. And if you have not subscribed, please hit the subscribe button, hit the notification bell so you can get all things DutyRon when I do go live, uploads, or premieres. BloodX, thank you so much for that super chat. I appreciate that. Thank you, everyone. Check out BloodX and his Grow Stream crew that he has there. They're wonderful people. Really, really wonderful people over there at the BloodX family. So this is the United States. Most of us here are in the U.S. I'm going to cover all of the population throughout the world. We're going to talk about the other countries. 85,500 confirmed coronavirus cases in the United States. 1,288 deaths. We've surpassed the 1,000 mark. 713 recoveries. Disturbing figures coming in here out of New York. Disturbing figures coming in out of New York. I'm going to zoom in the map and I'm going to bring it on over to New York so we could look at these figures. New York is this is a small screen popping up here, so I will read it off for those of you who can't see the numbers. A confirmed 23,115 cases in New York, 365 deaths. No patients have recovered in the state of New York as of yet. And wait a minute, it says recovery is 0. Okay, active cases 22,747. That's minus the deaths. Again, we have a situation here where it's a breeding ground for this in the New York City area. If we go and look at Nassau County, this is the county that I live in, you have 3,914 cases, 17 deaths. Nassau County is not large, but it's not small. And a lot of the cases from Nassau County come in from the 5 boroughs, from Queens. So some of the people who live right on the Queens and Nassau border are also brought to Nassau hospitals from the city. So that's why the number there is pretty high. Suffolk County, which is out east, has 2,700 cases, 22 deaths. A lot of those deaths were elderly patients in nursing homes out in Suffolk County. So this is a situation that is less than ideal. Again, I'm not a panicker. I'm not a worrywart, but I am concerned. The U.S. cases we've surpassed China. Here's China's figures: 81,782. Paul Peck Drywall, thank you so much for coming. Chrissy, thanks for sharing. Marcy, thank you for being in here. Thank you guys for all being in on the live stream. So let me just get to Italy. China, everything has slowed down in China. A lot of these confirmed cases are stopping. It looks like it's 3,291 deaths, 74,000 recoveries. Italy's still getting hit hard, 80,589 cases, 8,200 deaths. That's a lot of deaths in Italy. And then the list just keeps going. Spain is getting hit hard. Germany's getting hit, 4,300 deaths in Spain, 7,000 recoveries. Germany, 43, almost 44,000 cases, 267 deaths. France, where Nabil is from, is almost 30,000 cases, almost 1,700 deaths. And the United Kingdom's getting hit hard. My good friends in the UK across the pond, 11,800 cases, 580 deaths. So we do have quite a bit of spread in those countries as well. Let me bring it back up to yours truly. Hello, folks. Thank you for joining. Thank you for being in here tonight. My purpose was not to go live to get anybody worried or get anybody scared. Hi, ladies and gents. Thanks for joining. Katrina Porter, thank you for being in here. Yeah, your county you're lucky. Listen, for those of you who feel it's not going to reach you, be careful. Don't get a sense of it can't come here. None of the cases are coming here. They're talking about New York having this spike and surge, and then it's going to level off. We don't know when it's going to level off, but when it does, it will continue on and spread across the country. I'm going to go back to the U.S. on the map here and show you guys I'm going to get off of here. Hi, ladies. Hi, guys. Gents, thanks for joining. If you can, please share out the broadcast. Hit that thumbs up. Subscribe to the channel here. Follow me on Instagram, Facebook, and Twitter. All social media, all one word, DutyRon. Thank you to Paul Peck Drywall, John Robles. Good to see you. Katie, thank you for coming. Winky Whispers, MJ Doris. All the great ones. And if I don't get to you, faithful one, thank you. Inner Peas. Always got to say hello to Inner Peas. Much love and respect. Let me show you the figure here from the United States. So here's the spray chart. I hate to refer to it as a spray chart, but that's really what it is. So if you look here, there's not many places in the United States. I look at this daily, folks, and I don't look at it daily to scare anybody or scare myself. I want to be educated. I always talk to you guys about being educated. So I look at these dots all over here, and I look at the concentration here in New York. But I saw so many less dots throughout the country just 3 days ago. The concentration here and down south, down in Florida, down in Mississippi, down in Houston, Denver. 3 days ago, it wasn't as many dots, as many red dots. And the larger the red, the more cases. Confirmed in Colorado, Denver, 266, 3 deaths. What I'm trying to tell you is that the scientists are saying that this cluster here on the East Coast and the cluster over here in San Francisco and the cluster up in Seattle, it all branches out, and it will, I hope they're not right, but they're talking about most of the United States being covered in red. When this is all, we're just getting ramped up. So welcome in from Michigan. Thank you for joining. I'm not trying to get people scared. I'm not trying to get people worried here. I just want you to be informed. I want you guys to be informed. I want you guys to understand what's going on and what the potential is here for, let me just unpin that message so people aren't confused. The potential for what we can have going on. I want you guys to listen because he is a very sensible man. I want you to listen to Governor Cuomo. The governor of the state of New York, Mario Cuomo, is a great guy. Good evening, Lisa 1111. Thank you for coming. So if you listen to Governor Cuomo and you hear what he has to say, I want you guys to hear snippets of his press conference from yesterday. Again, New York has the most cases here. Cousins, thank you so much. New York State has over 37,000 confirmed cases of coronavirus. 37,000 cases. That's a huge number in one state. So the amount of cases that we have is more than what France has in total for their whole country. What United Kingdom has, we have 3 times the amount just in the state of New York. So it is concerning. I live here. I still go out daily to my my position that I have, which is one of the necessary, one of the grandfathered in businesses where you have to still stay open. So I'm going to work on a daily basis, and the governor here, the state of New York, is given valid information, and he's delivering it clear and concise and without fear. What we're having the most problem with is ventilators. We're having the most problems acquiring ventilators for potential patients who could be in ICU. So there you go, Alexis P. Yes, Canada, it is slow, but it doesn't mean, don't get a sense, for those of you who are in areas that is slow, don't let your guard down. Don't feel like, oh, we're good. We're in this for a long time. This is not something that's just going to go away tomorrow or next week. So be advised, you practice your social distancing, the hand washing. I don't think you need to wash packages. I think you need to just use caution. If you handle a package, go and wash your hands immediately after that. I see people washing boxes, washing the bottoms of their feet. Yeah, I leave my shoes outside, but I do that all the time anyways. I don't want to track in garbage and people spit into my house if I'm walking outside. Leave your shoes outside, but you don't have to go crazy with the washing. Wash your hands if you handle a package immediately after you handle the package. Broncos Chick, thank you so much. Hello, First Live. Thank you for coming in and saying hello from Colorado Springs. I appreciate that. Thank you. Hello, Premier Hell. Everyone go follow and subscribe to Premier Hell. Katrina Catress, Joey Brooklyn, Paul Peck Drywall. The list goes on and on of the great ones in here. Representing the NYPD here. So let's get to this because it's going to take me forever if I don't get to this. So let me cue it up. This is a press conference from Governor Cuomo from yesterday. So I'll watch it with you guys in the tiny cam. Hold on. Oh, here we go. All right, so let's watch this together.
Number of ICU cases at this point.
I'm sorry, Mr. General's office, and he's part of our SWAT team. We have James Malatris, president of Empire College.
This was from yesterday.
Zucker, Health Commissioner. Melissa DeRosa, Secretary to the Governor. Robert Mejica, Budget Director. We have a lot of interesting news today. Things are moving. Current status, we still have the trajectory going up. We have not turned the trajectory, nor have we hit the apex. Remember what that line is going to do. It's going to go up. It's going to reach a high point.
Listen up.
Tip,
Listen to this.
It's going to go back down. We're still on the way up the mountain. Number of infections that have been coming in, 80% still. self-resolved. About 15% of the people who test positive require hospitalization. And then there are degrees of hospitalization, right? But the total universe that requires hospitalization is 15%. We use projection models. We have Cornell Weill, which is a great medical institution that does projection models. We use McKinsey that does projection models. Department of Health does projection models. The projection models are important because they are projecting the possible trajectory and projecting the possible need, right? So we're planning for a need. The projection models do that. The projection models are just that. They are models of projections. They're not necessarily definitive, but it's the only device that we have to plan, right? Follow the data, follow the data, follow the data. The actual hospitalizations have moved at a higher rate than the projected models, than all the projected models. So that was obviously concerning because that higher infection rate means faster, higher capacity on the hospitals, and that's the critical point
Mike,
for
thanks.
us is the number of people going to hospitals. Right now, what we're looking at is about 140,000 cases coming into the hospitals. The hospital capacity is 53,000 beds. That's a problem. We're looking at about 40,000 ICU cases coming into the hospitals. We have about 3,000 ICU beds. That's a challenge. What is an ICU bed for these purposes? Basically a bed with a ventilator. The ventilator is the most critical piece of equipment for an intensive care unit bed.
So this is where the biggest problem is, ICU ventilators.
And people need more ventilation than usual. What do we want to do? Reduce the number of cases coming into the hospitals, slow the number of cases coming into the hospitals. That's what Dr. Fauci is talking about on TV every day. Flatten the curve, flatten the curve, flatten the curve. Slow the number of people coming into hospitals so we can deal with them in the hospitals. And we are working on that. At the same time, increase your hospital capacity, right? So try to slow the number of cases coming into the hospital, meanwhile raise your hospital capacity. We are working on both simultaneously. We have been from day one. Reduce the number of cases coming in, flatten the curve, slow the spread of the infection. We are doing everything we can on that. That's banning non-essential workers, that's social distancing, that's closing restaurants, closing gyms, just flatten the curve, slow the infection rate. One issue we had was in New York City, where we had a higher level of density than we wanted, especially in the New York City parks, especially with young people. I've been as direct as I can and as blunt as I can on young people and the misinformation that they have. You can catch the coronavirus. You may think you are a superhero. You're really not. You can catch it, and you can transfer it, which makes you dangerous to the people who you love. But the New York City parks have been a problem. I saw the problem myself firsthand. I spoke to Mayor de Blasio. I spoke to Speaker Johnson. We said come up with a plan in 24 hours that everybody agreed with. They came up with a plan. We're now implementing that plan. I signed off on that plan. The plan is going to pilot closing streets in New York City because we have much less traffic in New York City. We have many fewer vehicles in New York City. Open streets. People want to walk. They want to go out and get some air. You want a less dense area. So pilot closing streets to cars, opening streets to pedestrians. We'll also enact mandatory playground social density, which is probably a new concept. No close contact sports in a playground.
This is important.
No basketball.
This is big time important. This was going on like crazy in the city.
We're asking people to do that on a voluntary basis. If there is non-compliance with
Police
that,
are now
we will
patrolling
then
the
make
playgrounds.
it mandatory, and we will actually close the
NYPD
playgrounds.
is
We
patrolling
don't
the
want to do
playgrounds.
that
Hi, Caitlin.
because playgrounds
Hi, Red Like
are
Wine.
a place to go out and get open air, but you have to exercise social density even in a playground.
Hi, Nellie Bell.
And again, it's voluntary. The mayor is going to make it clear that this is important to the people of the city. If it doesn't happen, we will actually close down the playgrounds. I don't want to do that, but
That's what's
we
gonna
do
happen.
need to reduce the spread of the
They're gonna wind
infection,
up having to
and
close
that
the
is what is
playgrounds.
most important. This is very interesting because the evidence suggests that the density control measures may be working. And again, we're doing this from projections. But look at this because it's interesting. This past Sunday, the projection was that hospitalizations were doubling every 2 days.
Listen to this.
Okay? On Monday, the numbers suggested that the hospitalizations were doubling every 3.4 days. On Tuesday, the projection suggested that the hospitalizations were doubling every 4.7 days. Now, that is almost too good to be true.
That's excellent. Excellent, Miss Family
But
Tree.
the
Same
theory
thing here in
is,
Nassau. Everything's closed.
given the density that we're dealing with, it spreads very quickly, but if you reduce the density, you can reduce the spread
There you
very
go.
quickly.
Reduce the density,
So,
reduce the
These
spread.
projections, I've watched them bounce all over the place, and I don't place a great deal of stock in any one projection. All due respect to all the great academics and statisticians who are doing it. But this is a very good sign and a positive sign. Again, I'm not 100% sure it holds or it's accurate, but the arrows are headed in the right direction, and that is always better than the arrows headed in the wrong direction. So to the extent people say, boy, these are burdensome requirements, social distancing, no restaurants, no non-essential workers, yes,
It's all
they are
necessary.
burdensome. By the way, they are effective and they're necessary, and the evidence suggests at this point that they have slowed the hospitalizations. And this is
Washington County
everything.
News, thank you.
Slowing the hospitalization rates coming into the hospitals are everything so the hospitals can deal with the rate of people coming in.
Correct.
At the same time, increase hospital capacity. What is the high point? You see that line in the beginning? What we're studying is what is the high point of that line? What is the apex of that line?
Not in the,
That is the
not in New
point
York.
of the greatest number of people coming into the hospital system. So that's our greatest load, is the apex. And when is that going to happen? Again, that is a projection. Again, that
Infinite
moves
beauty,
around.
just chill out.
But the current projection is that
And
could be in 21 days.
cousins,
So
just chill.
ramp up the hospital capacity.
It's not the time or
to
place for
make,
that.
to be able to handle that apex volume. How do you ramp up hospital capacity? You ramp up beds, you ramp up staff, and you ramp up the equipment. And the ventilators are the problem
There you
in
go.
equipment,
Increase the
as we've
capacity.
discussed many times.
They're
Where
gonna
are
talk
we on
about-
that? Beds?
They're going to talk about sharing
We may need
ventilators.
140,000.
This is an
We have
interesting concept.
53,000. That's the
Splitting
existing capacity of
ventilators.
hospitals. We told all hospitals they have to increase their capacity by 50%. I told them that myself on a conference call yesterday. This is a burden for the hospitals.
No worries,
to
cousins.
now say
Hold.
you have to increase capacity
This
50%.
is
but I
an
have to
interesting
tell you,
feat to
they
try
were
to
very generous
try to
about it,
accomplish.
and they understood what we were dealing with.
For
And they were
hospitals
eager
to
step
double
up
their
to the plate.
capacity,
If you
it's
increase
difficult
hospital
at best.
capacity by 50%,
All right,
that gets you
let me just say something really quick here to everybody in the chat. Okay, basically, supplies and that video that I think millions of people have already seen today that was out by a doctor at Elmhurst Hospital in Queens. I'm not saying it was a bullshit video and a piece that was done, but it was definitely a piece that tried to instill fear, and it did do that. It worked. My good friend works in that hospital. And she told me that the FEMA and the federal government they are so overstocked with supplies at this time right now. If that in fact was the case in the days before, I spoke to her today. And she said, we have enough N95 masks to go around. We don't have to use the same one 3 days in a row. We have face shields. We have hospital gowns. We have gloves. We have everything. What they need is the ventilators, and that's on the way. That is on the way. And just so you know, because of the national state of emergency, those refrigerated 18-wheelers for temporary morgue, that was put into place by New York City. By New York City, all New York City hospitals have the capacity to have those refrigerated trucks there. That doesn't mean that the bodies, we're going to be filling up bodies inside those 18-wheelers, but they're there just in case. Everyone says, well, we're not prepared. Well, now we're preparing, and we're getting everything done just in case. So don't get freaked out by that. Don't lose your cool over the Health and Hospitals Corporation, which is in charge of the city of New York's hospitals, over planning for the unknown. They're planning for the unknown, and that's not a bad thing. Not a bad thing.
7,000 beds. On top of the existing, it takes you to 80. Some hospitals, I asked as a goal, try to increase by 100% your capacity. 50% was the minimum. The goal was 100. I believe some hospitals will actually try to do that. And I encourage them to try to do that, as impossible as it sounds. But now is the time to be aggressive and do things you've never done before. If some of them do that, and I believe some of them will,
no worries.
That would be additional 5,000 beds. We get to 85,000 beds. FEMA, Army Corps of Engineers, what we're doing in Javits Center, what we're doing in the Westchester Convention Center,
Okay, and now all of these additional facilities, the Army Corps of Engineers, 1,000 beds at the Javits Center in New York, the naval ship that's going to be in New York Harbor, I believe, on Monday, the USS Comfort, I think it's called. That's 1,000 extra beds. It's a floating hospital that's ready to go with staff and everything. Though that's all for backfill. That's for regular people who are probably going sick, car accidents, people who break a leg, people who have heart attacks. Don't forget, there's regular emergencies that go on a regular basis. So that's going to be overflow, so the regular hospitals on the ground can handle the COVID-19 and coronavirus patients. So that's going to be probably backfill for people who get sick, people who have strokes, heart attacks, break a leg, all of the regular things that go on. We have to realize, in addition to this pandemic of all these additional cases, 37,000 cases in the state of New York, we need to be prepared. And this is all scary, but it's necessary because you don't want to be caught with your pants down, so to speak. All right. So this is what's going on. This is the powers that be, the governor, the state, the local, and the federal, all working together. So don't get freaked out by that.
Campus, Stony Brook campus, that's another 4,000, takes us to 89,000. The U.S. Navy ship Comfort, the president dispatched.
There you go. I just
that would be 1,000 beds to backfill from hotels. That takes you to 90,000. If we take all the state dormitories in downstate New York,
they're not going to have to do that.
that could get us an additional protective equipment right now. And
don't forget, this is from yesterday.
No hospital, no nurse, no doctor can say legitimately protective equipment.
This is from yesterday.
We have been shopping around the world. We have a whole team that's doing it. Right now, we have enough protective equipment, gloves, masks, gowns, for all the hospitals statewide that are dealing with it. I put down a
You're in for the long haul, Premier.
Yesterday. Today, no hospital, no nurse, no doctor can say legitimately, I don't have protective equipment. Right now, and for the foreseeable future, we have a supply. We do not yet have secured a supply for 3 weeks from now, 4 weeks from now, 5 weeks from now, but we are still shopping. And taking care of this immediate need was also good news and a good job by the team. And again, we are still shopping for more equipment. Ventilators, ventilators, ventilators.
Here we go.
We need 30,000. We have, in the existing hospital system, 4,000 ventilators. This is just in the normal operation of hospitals, et cetera. We have purchased 7,000, and we are still shopping. Federal government has sent 4,000. We're exploring splitting, where one ventilator could do 2 patients. Italy has had to do this because they were forced to do it. I want to see if we can study it and do it a little smarter and have a little more time experimenting with it, but we're looking at splitting the ventilators. We're still working with the federal government to try to find more ventilators, but that is our single greatest challenge, are the ventilators. Again, the ICU beds, that really means a ventilated bed. Because, again, this is the #1 piece of equipment that we need. You have beds, you have equipment, you need staff, and you need staff understanding that some staff is going to get sick.
Stay well.
And they're going to be out. So we have been working on putting together a surge healthcare force. Go back to the retirees, go back to nurses and doctors who may not be in the
40,000
hospital,
retirees
direct medical
have
care,
responded to come
occupation,
and
and
forward.
ask them to sign up for, that's a big,
Look at these
have
numbers.
signed up because
Look at
you
this.
can create beds,
2,200
you can find the
physicians,
equipment,
93
you have to have the staff.
anesthesiologists,
and you have to have the staff
86
for
emergency
those
room,
additional beds, which are not now in the hospital.
86 emergency room nurses and staff, 30 intensive care, infectious disease doctors, pulmonary, nurse practitioners, physician assistants. Look at those numbers, guys. That's 40,000 people who were retired coming back to work. Jigsaw Puzzler, thank you for coming in. So, unbelievable amount of New York. This is New York only. This is for New York. 40,000 responded and volunteered to come back. And this is the breakdown of who was willing, able, and ready to get on the front line and possibly contract coronavirus by treating patients. These are heroes. These are the heroes right here, ladies and gentlemen. These are retirees that were at the end of the gate. And I got news for you. If they called me and asked me to come back, I would do it. If the police department called me and asked me to come back, I would do it.
Hospital system.
Thank you,
and
Katrina.
you have to have staff when the existing staff gets ill. Or, by the way, just can't work the hours that we're going to need people
There
to
you
be
go,
working.
Angela.
So that's very good. This
is important, and I hope Infinite Beauty is still here. 6,175 mental health professionals signed up, and that's the hotline where they are volunteering their time to counsel anybody that's experiencing PTSD, anxiety, separation anxiety, fear. You guys got to listen to this. This is all for the state of New York. Unbelievable.
is also very exciting. I don't know that anyone else has done this. We've talked about the emotional stress that this brings on people and the mental health stress and the mental health challenges.
Thank you, Danielle.
No one's really talking about this. You know, we're all concerned about the immediate critical need, the life and death of the immediate situation, which is right. But don't underestimate the emotional trauma that people are feeling and the emotional health issues. We asked for mental health professionals to voluntarily sign up to provide online mental health services. 6,000 mental health professionals agreed to volunteer to provide mental health services for people who need it.
Volunteer.
How beautiful is that?
Without pay.
And the hotline, 1-844-863-9314.
Winky, if you could put that in the chat, I'll greatly
You can
appreciate
call
that.
that hotline. You can schedule an appointment with a mental health professional, totally free.
There, if someone could put that phone number in the chat for New York State Mental Health Hotline, for anybody, any of the 37,000 plus people, family members of those victims that are now contracted coronavirus, and the numbers will rise as we speak.
To talk to them about what you're feeling and what stress you're feeling.
It's amazing.
And again, God bless the 6,000 mental health professionals who are doing this 100% free, on top of whatever they have to do in their normal practice. And I'm sure in their normal practice, they're busy. So this is really an extraordinary step by them. Federal government, I spoke with President Trump several times. I spoke with him last night. I spoke with him this morning. I've spoken to people in the White House who are handling these operations.
Thank you, John,
I've
for doing
with the
that.
Vice
Thank
President. I've spoken with Jared Kushner, who is
yes, you have to be
New
licensed.
Yorker. He knows New York, and he's working in the White House. And
Thank you, Jen.
He's been extraordinarily helpful on all of these situations. What we're working on is a common challenge. No one has these ventilators, and no one ever anticipated a situation where you would need this number of ventilators.
Listen to
deal
this
with the public health
idea he has
emergency.
here. Listen to this.
So we have purchased everything that can be purchased.
Hi, Oracles.
We're now in a
How are you?
situation that we're trying to
Tanya.
accelerate production of these ventilators, and a ventilator is a complicated piece of equipment. The president and his team, I think, are using the DPA well, because it's basically it's a leverage tool when you're dealing with private companies, right? We need your help. We can demand your help, or you could agree to help, and we need you to step up and increase production. Even with that, there's a ramp-up time
Doing well,
for
Lisa.
a company to put together
Hope
the
you're doing
supply chain, put together the workforce, and get these things up and running. So Ford, you hear, is going to help. General Motors is going to help. The problem is our timeline is so short. We're looking at an apex 21 days in that range. To get ventilators and these business consortiums put together to the White House about another concept.
Listen to this.
New York has the greatest need in terms of numbers. New York also has the most critical need in terms of timing. Right?
Hold on. Interpeas, you're correct. I did not like his initial response. In the early days, and I'm not going to do it here because I'm not a crybaby, this guy was acting like a child and wah, 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 wah in the beginning. Now he's actually taken charge and not being a crybaby. He's actually taken charge for the people of the state of New York, and he's handled himself well. And I'm the first to say that, yeah, I didn't like him in the beginning. And now he's turned it around. So, you know, some people start off horrible, which I think he did, and now he's sprinting. He's on high speed turbo now, so he's doing a great job.
Right, we talk about our apex, we talk about that curve.
Correct, Angela.
Different
Correct.
localities, different regions around the country
listen to this idea he comes up with.
different curves. We are in some ways first. Our case numbers went up first. Our trajectory is first by a long shot. Different regions will have their curve at different
Edwin.
times.
Stay safe. Just listen
What
to
I
this,
said
guys.
to the president and his team was, look, rather than saying we have to provide equipment for the entire country at one time, let's talk about addressing the critical need in that hot spot. Once that hot spot turns, because you have an apex and then you have a curve, and the curve is relatively short, Once you address that hotspot with that intensity, intense equipment, intense personnel, then shift to the next hotspot and have more of a rolling deployment across the country than a static deployment.
This
right?
is a fucking awesome idea.
I was in the federal government at HUD. I worked on dozens of disasters.
This is a great idea.
You deal with the disaster in front of you at that time, and then you move on to the next disaster.
Joey Brooklyn, welcome.
And I think that rolling deployment could work here. And on behalf of New York, I said we will be 100% helpful. We need help from the entire country right now. We need resources from the entire country right now. And because our apex is first and our numbers are highest. But the apex high point will be sequential across the country. So I said to the White House, send us the equipment that we need, send us the personnel.
30,000 ventilators.
As soon as we get past our critical moment, we will redeploy that equipment and personnel to the next hotspot. And I will personally guarantee it and personally manage it. So if you send us 15,000 ventilators, and then after our curve, Los Angeles needs 15,000 ventilators, we can take the equipment from here, we can take the personnel from here, we can take the lessons from here. You know, we go first. We're going to learn things that nobody else has learned because we're going to be the first one through the chute. And I personally guarantee that we will bring that equipment, we will bring that personnel, we'll bring that technical assistance to the next hotspot.
You know what? I'm not really worried. Hold on a
President,
second. Let me just address that, Bunny Bubs. He definitely is an exceptional speaker. But I'm not comparing the White House to him. Each governor gives a news conference. New Jersey's governor gives a news conference. He's not as well spoken, but he's also a take charge guy. Just because the person doesn't speak well doesn't mean that the person is not going to get the job done. So this is not the time or place to start comparing or pointing fingers. We're in a crisis right now where people are dying. So what's important is not just these words, but the actions, because actions speak louder than words. So at the end of the day, when everybody wants to sit at home on their ass saying, oh, this one didn't do this one didn't do that. This is a global pandemic. This is not just in the United States. This is the world. And it is enormous undertaking for anybody, any president, any governor, any elected official. This is not a little fucking game. This is major league, big time, on a huge, largest scale that you've ever have. Nobody's ever even thought of this. Just like when we saw the World Trade Center crumble, and me personally, I saw Tower 2 crumble in front of me. I would have never thought in my whole entire life that I would have ever seen that. Okay, this is the same kind of concept, but on a larger scale. So let's not get involved and get into that whole game of saying, well, he speaks better than he speaks. I don't go for that. I don't like it. And if anybody wants to do that here, I'm going to block your ass because that's bullshit. I don't go for that one bit. Let's listen to the rest of this. And please, if you want to be here, just respect what's going on. Don't sit at home from your couch and your comfy couch inside, bunkered down, pointing fingers at elected officials because there's no playbook for this. There's no playbook for this whatsoever.
Part of going to the next hotspot with our team. We're asking the country to help us. We will return the favor. And
I like this guy's idea.
We are all in this together.
I like this guy's idea.
And we're asking for their help and their consideration, and we will repay it with dividends.
The ventilators is what saves lives. When people are in trouble and people are dying, they need these ventilators. So this is important. This is important to get. We need to have them here in New York, and then we need to pass them and pay it forward to the next major hotspot, just like he said. Now, this is about the money. I'm going to scroll forward.
We need the House.
This is him
Any
talking about the
hospital
money.
in the state can perform testing. You can walk into a hospital in Buffalo, New York. If you show the symptoms and meet the protocol, you can be tested. Strategically, we deploy testing in the most dense areas. Where do we set up the drive-throughs, et cetera?
They're
Why?
both
Because
hunky-dory
we're
now.
hunting positives.
Because Cuomo realized that by him criticizing the president and the federal government was not going to help the citizens of the state of New York. And even de Blasio, as much of a jerk off as he is, de Blasio even now is sucking up to the president because we're talking about billions and billions of dollars in aid that the president has at his power. These people don't like the president. We know that. And it doesn't take a brain surgeon to figure that one out. But now they're sucking up to him for good reason, because we need the help and we need the money. And so is your state. Your state needs the money too. So any elected official that was carrying on like he did in the beginning and like the mayor of the city of New York did, de Blasio, the way they acted was counteractive for the people who elected them into their office. So they finally just woke up and said, whoa, $850 billion or $2 trillion. I need to start sucking up a little bit. And that's what's going on.
We're hunting positives so we can isolate them and reduce the spread. You're more likely to get positives in high positive areas, right? Set up a drive-through in the Bronx versus set up a drive-through in Chautauqua County. You're going to get more positives in the Bronx, and that's
Correct.
what we want. But anyone, anywhere in the state, you have symptoms, you're concerned, you can walk into any hospital. That hospital can get a test performed. Number of positive cases, we're up to 30,000. Number of new cases, 5,000. Again, you see the numbers, 13,000.
These numbers are way higher. Let me get my notes out and I'll show you real quick. Hold on.
I'm sorry, 17,000 New York
Hold
City.
on. So these were the numbers yesterday, right? These were the numbers yesterday. New York City now has 23,000. This is one day later. So up here it was 17,856. That was yesterday. Today and right now it's probably higher, 23,112. So between one day and a 24-hour period, it went from 17.8 to 23 and change. Total cases. 365 deaths. They're not going over the deaths here. But Nassau County yesterday was reported 3,285. They have 3,915. That's my county. Suffolk County, 2,260 here. They're up to 2,735. So these numbers are just going up. They're just going up, and they're going up high, quickly, at a high rate of speed. But they are doing a high amount of testing in these clustered areas. So, like he says here, the more testing we do in the cluster areas, the more positives you're going to get. If you were testing in somewhere where there's not a high surge or high density, you're not going to get positives. You'll get negatives. They want to know what's happening in the major metropolitan. So
4,000 in Westchester, 3,000 in Nassau County. Relatively, Westchester, we have dramatically slowed what was an exponential increase. So again, on the good news side, can you slow the rate of infection? Yes. How do you know? Look at what we did in Westchester. That was the hottest cluster in the United States of America.
sure was.
We closed the schools, we closed gatherings, we brought in testing, and we have dramatically slowed the increase.
Absolutely.
Nassau County is 3,000. They're relatively right behind Westchester. They
We're close to
were
4,000
at like
now.
0 when Westchester had started. So we can slow it, and we have slowed it.
Thank you, Katrina.
Again, you see
Thank
it
you,
spreading
sweetie.
across the state, which we said it would. Current numbers, 30,000 tested.
Okay, so 30,000 tested positive. That was yesterday. We're over 37,000. So in less than 24 hours, there's been 7,000 positive tests in the state of New York. I got the numbers right here. And I could show it to you on the graph chart. So 7,000 positive overnight. Overnight, 7,000 in New York State. This number is going to swell. God only knows how many cases, but they're going to continue to test and they're going to continue to get positives.
Positive. 12% of those who test positive are hospitalized. 3% of the positives are in ICU. Okay? This is deep breath time again. I'm anxious, I'm nervous. What does it mean? 30,000 tested positive. 12% are in the hospital. 3% are in ICU. If you look at those 3%, they're going to be predominantly senior citizens, people with underlying illnesses, people
Correct,
with
Cynthia.
emphysema, people with a compromised immune system. That's what this effort is all about. All the noise, all the...
Let me just stop this for a second here, okay? And the reason why we are trying to slow this curve and slow this whole thing down is because the more people that get infected and the more people that you spread to, the more potential for death you have, right? So if we were to if everything was opened up, all the restaurants were open, we could go to baseball games and we could do all this, you can potentially talk about the numbers. This 3%, 12% in the hospital, it would be 50%. The 3% positives in ICU would be 10 times that. These numbers are with everything shut down. No workforce is at work in the state of New York and probably all over the country. Nobody's at any social gatherings. People can't get married. You can't have, the country is shut down, and these numbers are happening. We had the spike from 30,000 to 37,000. And when we wake up tomorrow in the state of New York, it's going to be 40, 45,000 or more. So this is all to save lives. This is what this is about, is to save lives. Okay? If people were flooding into Yankee Stadium and 50,000 people showed up at Citi Field and Yankee Stadium, and we had basketball games going on and all kinds of sporting events going on, and soccer, and little Johnny was able to play baseball with all his little rugrats, we would have a mess on our hands. And then everybody was going to work on the subways. The subways are shut down. New York City is just too densely populated. It's not too damn big. It's too damn populated. And that's the problem in the city of New York, is everyone's on top of each other. So I think we covered enough. I was going to show
energy,
today's.
It's about that 3%.
Hold on.
Take a deep breath. Now, that 3%, that's my mother, that's your mother, that's your sister. These are people we love. These are our grandparents. And we're going to do everything we can to protect every one of them. And I give the people of the state of New York my word that we're doing it. But we're talking about 3% of the people who tested positive, who we're worrying about. Most impacted states, we're at 30,000. Next closest state is New Jersey at 3. California, 2. This is a really dramatic differential. And this is what I argue to anyone who will listen. We have 10 times the problem that the next state has, which is New Jersey. You compare us to California.
New York has 10 times the problem of the next state, which is New Jersey's caseload. 10 times. So that's why the request for 30,000 ventilators, the request for massive amounts of supplies and money is because this could potentially turn into a worst case scenario here in New York. And what all the scientists and all of the biological doctors and the scientists are predicting is that, you know, it will eventually drop off, just like in China. But when does it drop off? You know, we're in this, according to what happened in China, for months. So we could look at spread going from New York to New Jersey to Connecticut to down to from state to state. We could look at spikes like this. But potentially, I don't think, in my eyes, that it will have that in some of the less densely populated cities and states. So New York has it bad because it's a breeding ground for this to spread like wildfire because of the density.
California, which is larger in terms of population, we have 15 times the problem. Now you have to ask yourself, why? Why does New York have such a high number? And again, in the totality, we understand what it means. But why does New York have such a high number? And this is my personal opinion. I like to make sure that I separate facts from personal opinion. The facts I give you are the best facts I have. And again, the data changes day to day, but I give you exactly what I have on a day-to-day basis. Personal opinion, why does New York have so many more cases than any other state? How can it be? You're 15 times the number of California. I mean, it really is breathtaking when you think about it. State of Massachusetts with 30 times the number of cases. So why?
California is 3 times the size of New York. California is 3 times the size of New York, and they have many more people living in California, but they're living spaced out over 3 times the size of the state of New York. So he's going to explain this now. Just listen to this and then we'll finish it up.
Why is the question that people ask me. 2 answers. Answer 1 is because we welcome people from across the globe. We have people coming here. We have people who came here from China, who came here from Italy, who came here from countries all around the globe. We have international travelers who were in China and who were in Italy and who were in Korea and who came here. And I have no doubt that the virus was here much earlier than we even know. And I have no doubt that the virus was here much earlier than it was in any other state, because those people come here first. That's the first answer. The second answer is because we are close. Because we are close. We talk about the virus and how it transfers in a dense area. It's literally because we are close. Because we live close to one another. Because we're close to one another on the street. Because we live in close communities. Because we're close to one another on the bus. We're close to one another in the restaurant. We're close to one another in the movie theater. And we have one of the most dense, close environments in the country. And that's why the virus communicated the way it did. Our closeness makes us vulnerable. Our closeness makes us vulnerable. That spatial closeness makes us vulnerable. But it's true that your greatest weakness is also your greatest strength. And our closeness is what makes us who we are. That is what New York is. Our closeness is what makes us special. Our acceptance, our openness is what makes us special. It's what makes us feel so connected one to another.
I agree.
It's what makes us so accepting of one another. It is the closeness that makes us the human beings that we are. The closeness is that New York humanity that I think exists nowhere else. The closeness is what makes our sense of community. And there's a gentleman who
That's his father
I
there.
still look to for guidance and for leadership and for inspiration. He's not here anymore for you. He's still here for me. But he said things more profound and more beautifully than most other people ever have. And one of the things he said that is so appropriate for today, we believe in a single fundamental idea that describes better than most textbooks and any speech that I could write what a proper government should be. The idea of family, mutuality, the sharing of benefits and burdens for the good of all, feeling one another's pain, sharing one another's blessings, reasonably, honestly, fairly, without respect to race or sex or geography or political affiliation. That is New York. It is that closeness, that concept of family, of community. That's what makes New York, New York.
Agreed.
And that's what made us vulnerable here. But it is also that closeness and that connection and that humanity and that sharing that is our greatest strength. And that is what is going to overcome at the end of the day. I promise you that. I can see how New Yorkers are responding. I can see how New Yorkers are treating one another. I see the 6,000 mental health volunteers. I see the 40,000 healthcare workers stepping up. I see the vendors calling me saying, I can help. That's New York. That's New York.
Bingo. Yes.
And that, my friends, is undefeatable. And I am glad, in some ways, that we're first with this situation, because we will overcome. And we will show the other communities across this country how to do it. We'll be there for them. We want them to be there for us. And we will be there for each other, as we always have been. Any questions?
How does the state decide who is prior?
Okay, so let me get off this. That was by far in my eyes, the best coverage, the best news conference that he's given to date, based on how he finished that up. Okay, we will get through this together, and I'm saying that to you guys from me to you. We're going to get through this together. I made a vow to all of you to stick with facts, with verified information, and I'm not going to ever try to instill fear into you guys. But if something goes down that is bad and is wrong and that is looking like it's not great, I'm not going to sugarcoat it and tell you guys everything's going to be fine when it's not. So at the end of the day, we need to stick together. We need to check on our neighbors, check on our family, check on our loved ones by phone. Do not panic. Do not fearmonger. Don't watch the people who are telling you the world is gonna be ending. Don't watch people who are telling you that we're all gonna die. Okay. Educate yourself. Go to cdc.gov like I do 2 or 3 times a day. Watch the videos that are on there from the World Health Organization. Watch and educate yourself on proper hygiene and social distancing. Heed the warnings. Don't go out if you have to, unless you have to. Don't go out if you have underlying health conditions. Don't get someone who you live with sick by taking unnecessary risks. Support each other through social media, through text messaging, through DMs. I'm always here for you guys. We will get through this together. Support your first responders, your police, your fire, your EMS. Support your letter carriers, your hospital workers, your nurses, doctors, aides, hospital, everybody who works in the hospitals, everybody and anybody that's out there. I could go on for 20 minutes saying who to thank, but thank all the people that are keeping their doors open to feed you, to keep the grocery stores going, the truckers. The list goes on and on. We have a lot to be thankful for. You know? Drink lots of water. Wash your hands. Be thankful. Don't be selfish. Don't point fingers at people. Don't bash people. Don't make fun of people and bully people on the internet. This is not a time to be against each other. Let's be together. Let's stick together. Let's get through this together. Thank you, Outback Outlaw, for the super chat. I'll read that. You're a good man, DutyRon. The message you provide is clear, concise, and shows your character. Cheers from Australia. Put another prawn on the Barbie. Thank you so much to the great people in Australia. I hope you guys are staying safe. I know you guys are on lockdown in Australia. But again, let's stick this out.
Thank you for the super love.
Thank you for that super love. Thank you for the
You're a
super
good
love.
man, DutyRon. The message you provide is clear, concise, and shows your character.
Wow.
Cheers from Australia.
Who's that lady? I never heard her before. Wow. Josh, you're always doing things behind the scenes that I don't know about. But seriously, let's listen. Black Rose, Winky Whispers, all my moderators, all of the channel members, all of my Patreon people, Joey Brooklyn, all the great ones that are in here. Thank you so much for being a part of this great family, the DutyRon family. There's the sign from Matty Boy Sully, DutyRon Way. Support your broadcasters. I know there was a thing in the chat about Will 411 now. I don't really know him that well, but he has contracted coronavirus. I say prayers and healing strength for him and his family. I hope he recovers fully. So I'm sending a lot of positive vibes and strength to 411. I think it was 411 now. I read it in the chat, but I was trying to stay focused on what I'm talking about. You know, if I read the chat and I get involved with all the messages that you guys are putting in the chat, I'll never get my point across. So I apologize. I'm not ignoring people purposely, but I try to stick to what I have to get out to you guys. Otherwise, I sound like a rambling idiot and I'm all over the place. So, again, let's stick together. Let's show love and respect. Let's pay it forward. Help your neighbors. Help people. If someone needs food to be delivered to them and are elderly and they live on in your immediate area, do the right thing and get the food for them. Help whoever you can help by phone, by video conference. The world of social media is a great world, and it can really work to our benefit in this trying times right now. So I hope I've provided you guys with some good information. Much love and respect from me to you. Thank you to all the super chatters, all the great interaction here. And thank you for all of your positive messages down below in the comment section. That means a lot to me. And I really thank each and every one of the ladies and gents who leave me comments down below and follow me on all social media. One word, DutyRon. Thank you guys. God bless America. God bless the world. And God bless all of us. I'll see you on the next live. Good night from New York City, the epicenter of the coronavirus. Good night and God bless to all of you. I love you guys. Thank you. Peace.